HOPE TMS works when many other things don't. At Acacia, we like to take care of some of the hardest patients out there. We see people with very severe cases of depression, but often along with depression come things like anxiety or OCD or PTSD or a whole variety of other things. And for them, we have HOPE TMS. HOPE TMS works when many other things don't. We've just been working on some research and looking at just how treatment resistant our population is. And many of our patients have tried even electroconvulsive therapy or transcranial magnetic stimulation, the conventional kind. And even with that, the results continue to be quite good. Most people get better. This is really exciting because it means that even when you've tried everything else, this is still an option for you. At Acacia, we want people to not just live well, but to flourish. Sometimes people are not able to do that because of these conditions that are so complex. And so we want to bring people out of this misery, out of this despair, and we want to bring them into these lives of flourishing by removing these mental health challenges. With HOPE TMS, we look at the research, we look at the basic science, we look at the clinical evidence, and we're able to create a custom target for the brain that's able to provide the best chance that somebody's going to get better. HOPE TMS is an approach where we take the best we understand of the brain, of what networks are connected to what, and we direct the TMS at the best location we can to help people recover when nothing else has worked. The letters stand for holistic, optimized, personalized, expedited treatment. We had a patient who came to us a few years back before we had neuro-navigation, and we did accelerated treatment. It was only partly helpful. It relieved the symptoms, but a lot of the symptoms remained and they came back. And this patient had really severe mood problems, depression, suicidality, history of self-harm, and also psychosis. She had auditory hallucinations, voices that were constantly present with her for 10 years prior. So she was in her early 20s and she'd had this for many years. She came back to us after another year of being in and out of the hospital, in and out of residentials, in and out of various treatment programs, and we delivered a neuro-navigated version of this treatment. She got better. The voices stopped. She went into remission from her depression. The suicidality went away. She was able to go back to school. She was able to engage in hobbies. The conflicts with her parents resolved. So her life was transformed because we got the target right. And for some people, the target really does matter. TMS is a good idea for a lot of people, but for some people, they really do need the precision. They really do need the personalization. And she's one example of a life transformed because we got the target right. Acacia is the most experienced private clinic doing neuro-navigated TMS, more than anybody in the world. We've been treating hundreds of people. We have enormous experience bringing personalized and precision medicine, this hope that's been present for generations of psychiatrists, hoping that one day we'd be able to use an individual patient's brain where we think things are actually disordered and use that as the guide for actually treating patients. Hope as a concept and as a value is woven into everything that we do. The doctors here really care about getting people better even when nothing else has worked. I'm excited that this is the beginning and we're able to treat things that we weren't able to treat before. New conditions, new directions, new comorbidities, and it's just really exciting, and this is just the beginning.